such as the Community Hub, NECA, Northeast Kingdom Human Services, and rural community transportation. The question remains, why are still so many living under the poverty line? To address this, we have to look closer at the barriers affecting all of these systems. Accessibility awareness, where many families don't know what resources are available to them. Eligibility criteria, where they may not know what they qualify for and what they don't qualify for. And lastly, the stigma and pride associated with this issue, where families are too afraid to ask for help with the fear of being judged. Through this, I found that our systems aren't inherently broken. The real issue lies in the lack of communication between government officials and low-income families. This can be defined from a 2016 study by the Learning Policy Institute that revealed that reforms creating more adequate and equitable funding have had direct positive impacts on students' outcomes and success, especially for those who are low income. Additionally, a study by Neuenhuis mentioned that poverty at a young age led to major setbacks for educational attainment and well-being of those living in poverty. Moreover, a 2015 study by Farad highlighted that early disadvantages stem from the fact that 60% of a person's quality of life is influenced by their system around them. Therefore, living in poverty hinders their ability to live a happy and successful life. For my research method, I opted for a mixed method approach combining both quantitative data and qualitative data. I looked at how policy decisions affect the real realities that many families are living through. So my objective was to talk to many different members in the community to gain different perspectives. I started this by talking with the staff of our government officials, our U.S. Senators Bernie Sanders and Peter Welch. I then met with two community organizations, one being St. Johnsbury's Community Hub. The reason for this is because I want to get a perspective from somebody who sees the disconnect but isn't directly affected by it. I then talked to 5 low-income families to gain their idea of how they can navigate the systems that are currently in place. I attended 2 focus groups, one with prevention specialists and one with community members. And lastly, I met with 2 economic service directors in our district. The purpose of all these interviews was to compare and contrast and find what's working and what's not working in our current systems. The reason I opted for this is because I wanted to get first-hand accounts that much of our current research is lacking. First, I wanted to get input from those currently navigating these systems. Second, I wanted to talk with the staff of our U.S. Senators to discuss what our U.S. Senators are doing for our community. And third, I wanted to talk with the economic service directors as they act as a liaison between government officials and low-income families. This is because they can provide a perspective around the barriers that limit the effective communication. So I collaborated with St. Johnsbury's Community Hub, who helped me select my participants who are low income. So even though I didn't select them, I still wanted to ensure confidentiality while also having proper organization and proper disposal of all my research. So I did this by asking questions that couldn't be traced back to my participants, such as age, name, race, income, etc. I then only asked for their first names just to help with the proper organization of my data. And I also provided all my participants with a consent form stating that if any time they felt uncomfortable, the interview would stop and any and all information would then be deleted. Limitations. So with my mixed method approach, I wanted to use surveys also with this approach. However, I received a lack of survey responses from government officials. This is because I was using a survey platform that required a paid subscription. With this paid subscription, I could only be limited to 10 questions, I couldn't publish my survey, and I couldn't analyze any responses I got. So because of this, if I included it in my research, I would have had a delayed response for my research process. I then also had a problem contacting state legislators, as sometimes I'd email them, they'd email me back, but then there wouldn't be much follow-up after that, and it's really hard to get in contact with them and keep this contact. And these obstacles combined with government shutdowns and budget cuts reduced my sample size and ultimately postponed my data collection. So, through my research, I found that a big misconception is that many believe housing equals stability. However, that couldn't be further from the truth. In our county's population, 15.3% of the county faces a severe housing crisis. In addition, Vermont is a state with a very high cost of living, so many families, especially those who are low income, can't afford housing. In addition, the housing that we do have isn't stable, as 21.8% of the housing is at risk of flood exposure due to its old age. Another misconception is that older housing equals more affordable. However, 30.4% of the county's population is still spending 30% of their income or more on housing costs. Even though we had resources in place in the county to help this, such as a federally funded residential program, this program was to help youth ages 6 to 22 who were homeless, but recently this program ceases to exist as all of its funding has now been cut. When speaking with an economic service director, she mentioned that with the lack of housing vouchers Vermont is getting and the lack of money we're also getting, it's very hard to help those in need with this issue. I also want to provide some barriers that also limit the connection in Caledonia County, such as transportation, internet access, language barriers, and distrust from past negative experiences. All of these issues make it very hard to reach out and get help for services. Rural community transportation is a resource that many families use, especially those who may not have cars or access to vehicles. However, there are several barriers that hinder the effectiveness of this program. For example, the main transportation is this bus. While there are main vehicles used, the main vehicles are only able to be used for out-of-town doctor's appointments. So say you had to go to Price Chopper or a grocery store, you would have to take the main bus. The main bus only runs every 60 to 90 minutes. However, many participants have mentioned that this isn't effective as they're either late to their appointments or way too early. So say you have to go to NVRH for an appointment. Your appointment may last only 15 minutes. However, many have mentioned they've been waiting up to 45 minutes to an hour to be picked back up. I then want to provide the voice in the system from people who see the disconnect, from low-income families who say that they fill out forms and wait months and they still can't make ends meet, all the way to our elected officials who mentioned that with the budget constraints, it's not easy to enact proper legislation. The paperwork cliff can be defined as overwhelming months of effort to face denial. One participant mentioned that she applied for Social Security 3 times and was denied every single time. Reapplying is necessary every 4 to 6 years. However, when you do this, the government can deem you ineligible, even if you actually need these resources. For resources like Medicaid and Medicare, they're very lengthy applications and they're very extensive and complicated, so they're not easy to access resources. I then want to provide a comparison between Caledonia County's median income. So there's a total median income, which is around $60,000. This is then broken up between females and males, with females making around $39,000 and males making around $41,000. The median income in Vermont is around $61,000, with the national average being around $68,000. Again, since Vermont has very high cost of living, these rates should be slightly higher. As funding goes down and the cost of food goes up, it's very challenging to afford food, especially with the reduced income shown in the previous slide. As 9.2% of the county's population faces food insecurity. One participant mentioned that the challenge faced by low-income families in the community is food, with others mentioning the rising cost of food in the community. I then also want to provide a gap between the government perspective and the family reality, how the government deals more at a supply side than the demand side, and how they believe that our current system is flawed and corrupt, compared to the family reality who believes that our government is investing in a current system that isn't helping and they just keep investing in it. By examining this topic, it's evident that this framework fails to translate into practical and effective legislation. With the bureaucratic red tape and the infidelity of programs, these resources are very hard to access as they're not easy to navigate. With a lack of proactive measures, it suggests a systemic oversight where policies appear more reactive than proactive. Addressing these issues requires a more nuanced and empathetic approach by involving community voices directly into policy matters. This ensures that solutions are both relevant and impactful. So some of the implications I found through this research is that it raises concerns about why there hasn't been anything done or any action taken, especially if people have noticed a disconnect. This also shows that there's current flaws in our research, as they're not including the inputs from those who are low income. To effectively address these issues, we must fund current programs and reinstate funding for programs that have already been cut. For example, the Health Equity Advisory Commission is advocating for $1.57 million for marginalized groups, but without comprehensive reform and consistent financial commitment, These efforts only provide temporary solutions. The effective use of funds demands transparency and community engagement, where residents of Caledonia County can influence change by speaking out and advocating for themselves. By bridging this gap, it requires collab between both officials and residents, fostering more trust, communication, and meeting everyone's needs. Through this research, I was able to support my hypothesis that with our current systems in place, it affects families' ability to live a healthy and fulfilled life. When resources are cut and proper systems are not established, we must find a way to demand and bring community voices directly to the policy table. Doing this will prevent those individuals from falling through the cracks. But this is not a fight that can be fought alone, and it's going to require everyone. It's crucial to engage with our local organizations and speak up with our senators. We can do this by calling them or emailing them to ensure them that they are aware of this pervasive disconnect and are committed to addressing it. And most importantly, it's important to develop those deep connections with those whose voices often go unnoticed. Thank you. And I now welcome questions. No questions? Great. Yes, please.
You mentioned trying to communicate with senators, and I heard you say Bernie Sanders, but did you try to communicate with the state senators and representatives too? And how did that go? And did that have compared to the national ones?
Oh, sorry. So I did reach out to a lot of our state senators and representatives, and most of them, they would email me back, and then I would send them out my survey, and they just wouldn't, follow through with the survey. And I tried to obviously email and call them, but it's just really difficult to get in contact with those, especially in our state house, as obviously they're really busy, and with stuff happening in our country, it's just really hard to get in contact with those at our state level. And I also think with this problem, it also adds to the disconnect happening in the county. So, yeah.
So I appreciated your RCT analysis. And I wanted to go back to the disconnect between the officials and the lived experience of, you noted 12.6% of the population in Caledonia County were in poverty. So I just wondered if you had gathered the data on how many government officials, the people you talked to, had an opportunity to connect with?
So when I was talking with many people who I conducted interviews on, most of them had the opportunity to talk to our state senators, and a lot of them have mentioned that when talking to them, it felt like issues were being said, but it seemed like it was going in one ear and out the other ear. So it got to the point where they thought that our senators weren't really working to help them. It was more like they were just listening to listen to the problem, but much action was not taken after these interviews were held. So does that answer your question? Okay.
Is there anywhere in the state or country or world where there is not this disconnect between what people need and what is able to be provided to them?
I think, honestly, everywhere in the country, there's lots of different disconnects, especially I think it's big in our state because we are a rural state. So even though we are rural and kind of small, I think there shouldn't be as much disconnect as there is. But definitely in the world and in the country, there's definitely disconnects where there shouldn't be disconnects. So, yeah.
Did you feel a disconnect as like a young member of society trying to communicate with like these organizations and legislators? Like, did it affect you to be a young person? Because I know It's like we're a very old state, and so like, was there change in that?
Yeah, I also felt the disconnect just because even though I didn't really need like resources such as like Medicare or Medicaid, it just felt like trying to get in contact with senators was really hard. So I can only imagine if I actually needed these resources and I'm trying to get in contact with our people who are put in place to help us. So I definitely did feel the disconnect just trying to get input from our senators. Okay, is that it? Ready? Okay. Thank you.